Good evening, everyone. Um, excuse me. Welcome to today's webinar Wednesday, where we're going to be talking about creating your birth preference list or your birth plan. So we have just a short amount of time, and whether you know someone who's pregnant, whether you're pregnant yourself, knowing what to expect and determining your preferences for the birthing process is very important to the whole process. Um, because of this, the Maternal Health Network of San Bernardino County has worked together with the San Bernardino County Medical Society, San Bernardino Fatherhood, and Sankofa birth workers to discuss three of the most important things that families need to know when you're creating your birth preference list. And so this is the information that was kind of compiled for our presentation today. So, just a little bit about me. I'm Dr. Emily Rule. I am a pelvic floor physical therapist and I own Wings Physiotherapy in Apple Valley, California. We primarily see pelvic health patients that can include prenatal, postpartum, and pretty much anywhere on throughout the lifespan. Everybody has a pelvic floor. But so our goal for today is that by the end of this presentation, you'll know what to discuss and what to plan with your midwife or your OB. You'll know options and desires for your birth environment, and you'll know about considering alternative options if what's on your birth plan needs to change because things happen, especially in labor and delivery, and we can almost expect the unexpected. So there's a lot of information about planning for labor and birth, and we certainly can't go over every single thing right now. So this information has kind of been synthesized into three main points that subject matter experts agree are the most important things that families need to know when creating their birth preference list. So this is expressing your wishes and planning with your provider, what you can expect and plan for as part of the birth environment, and then understanding the need for flexibility, including secondary options should your list need to change. So after that, we'll kind of go over some resources for support. Oh my goodness, excuse me. So when planning with your provider, so during birth, obviously everyone's goal is for a healthy birthing person, a healthy baby, and a healthy family. Your provider's role in the birth plan is to facilitate an open discussion about your preferences and having realistic expectations. So, before you start writing your preference list, it can be helpful to take a childbirth preparation class, really to just help you understand better the basics of labor and birth and kind of what your options are. If you're just going in with absolutely no knowledge, you might have things in your birth plan that maybe aren't realistic. And so it might not be that your provider doesn't want to accommodate or they're not listening to you. Um, they just might not be realistic expectations. For example, you've had a cesarean section before. You might know a little bit about the birthing process, but say you want to have a VBAC, which is a vaginal birth after cesarean. If you are planning to deliver at a hospital that does not allow VBACs, it's not your provider. Um, it's your birth, the place where you're giving birth. And so just knowing kind of what those realistic expectations are can help you in making a plan. And maybe that means we change our plan of where we're going to deliver, but that's kind of a discussion for later. Um, so let's talk about planning. So, in addition to your midwife or your OB and your doula, if you have one, your support person should be involved with the birth planning and understand your preferences and wishes. Um, Labor and delivery is a very challenging time. And if you don't have somebody there who kind of already knows what you want, it can definitely make getting what you want a lot more difficult. In terms of pain management and labor augmentation, determine or discuss with your provider if you'd like to have an unmedicated birth or if you'd like an epidural, or there's other forms of pain medication that you can get besides just an epidural. If you want to have an unmedicated birth, some pain management preparation and techniques you can consider having a doula present for the labor and birth, take a birthing class from within, or sorry, take a birthing from within class the Bradley method birth class, hypnobirthing class during pregnancy, breathing exercises, relaxation, hot and cold packs, physical touch. A really common one in the hospital setting is having a comb and kind of squeezing the comb because that pressure from the comb can help. There's so many different things, but knowing what they are will help set you up for success during that labor. Um, Labor augmentation, this can be the use of Pitocin to either start or speed up labor. It can help explore the risks and benefits of being induced with Pitocin or other methods versus having your labor start on its own. So have that discussion with your provider of whether you should have an induction um, versus having labor start on its own. With everything in birth, this conversation from with you and your provider should be outweighing the risks and the benefits and seeing if what we want is beneficial, and if there are risks, what are the risks involved with that. You can also, in addition to having like things like Pitocin, have your preferences of how you feel about a forceps delivery, vacuum, routine IVs, and your willingness to have an episiotomy. So, for those of you that don't know, an episiotomy is when they basically cut you to help open up the vaginal opening and allow it to be a little bit bigger. Um, for the most part, though, these are no longer done routine. If we think back to like the 80s and the 90s, pretty much every woman got an episiotomy. But they're finding more and more with research that this actually isn't good. And as a pelvic floor therapist, I care about this because if you have an episiotomy, your chances of having pelvic floor dysfunction are a lot higher. Now, that's not to say there is never a time when an episiotomy is recommended or necessary, but it shouldn't just be a routine thing just because. I don't even want to say this out loud, but I had a patient one time tell me that the doctor at the hospital was having the student that was with them or the resident practice episiotomies. And so maybe they didn't need an episiotomy, but they overheard them saying, do you want to do an episiotomy? And then let's talk about planning or having an unplanned cesarean birth. So, if you're planning to have a C section for medical reasons, or if you need to have an unplanned C section, like an emergency C section, you can still have a preference list or a birth plan. Requests that you can make include you can ask for a narrative or a play by play of the birth as it's happening. You can request a clear drape instead of a solid drape if you want to see what's happening. I understand that this is not an option for everybody, but it is an option. Avoid medications that might alter your level of consciousness. So sometimes they can give you meds that kind of make you out of it, and then you can't necessarily experience your birth. And if that's something that's really important to you, you want to have that conversation. And then another thing that you can request is choosing not to have your hands tied down. Sometimes they do this just for safety, but to also help make sure that you're not moving during the delivery. And then post birth. Now, if you want to have skin to skin with your baby immediately after birth, even if you have a C section, this is something that is feasible. But you need to make sure that your providers and your partner, your support person, know of this so that they can advocate for you and make sure that happens. Also, you want to have a plan of how to feed your baby. We talked about this a little bit last week. But do you want to breastfeed or do you want to use formula? And if you want to breastfeed, you can actually request that a lactation consultant come to your room if you deliver in the hospital. If you deliver at home or at a birth center, your midwife should definitely be able to provide you with resources for that. Another thing you want to plan for is cord clamping. So you want to make sure your providers know if you plan to have delayed cord clamping, when baby's first bath is going to be, and any of the other newborn care options or routines that are standard if you want something different from that. What can be helpful also is document your preferences about which stool softeners or which pain medications work for you. Pain medications work differently for everybody, and if you have one that doesn't agree with you and you get it postpartum, that can obviously not be a good combination with no sleep and everything else that goes with those first few days or first few hours postpartum. So now let's transition and let's talk a little bit about the birth environment. Environment can be super crucial when we're talking about having a successful labor and delivery. So having a supportive and safe environment is key to helping a birthing person relax. There's several components of the birth environment that the birthing person can create for themselves. You can start by touring the facility while you're pregnant to understand what options, what amenities are available to you and your support system. I highly recommend this for anybody, especially if you're having a hospital delivery. That way, you know kind of what to expect, and you can ask questions about certain rules that they might have or policies. And that way, you can develop a birth plan that's within those policies. Or, like I said, decide you're going to birth somewhere else. So, some hospitals and birthing centers, like I said, have regulations on how many people can be in the room, and so you want to determine who you want to have with you. Do you want to have your partner, a doula, or anybody else? Do you want the entire family in there? Um, and then focus on what you and your support team can control, such as if you want a certain playlist or music to be on while you're in labor. Do you want the lights dimmed? Do you want your support person to massage you, or are you somebody that doesn't want to be massaged and you don't like hands on you? Um, do you want your birth person or your support person to recite any prepared birth affirmations? I am strong, I can do this. There's all kinds of things, but not every good thing for one person is the same for another. So having that conversation can definitely help you. And then if you're planning an unmedicated birth, research and determine if you want a fetal monitor hooked up to you continuously. Or do you want to request intermittent monitoring where the baby's only monitored every few minutes so you can move and walk around and just do more while you're in labor? You can also talk about having a HEP block instead of an IV because it can be less inhibiting. Um, and then talk with your provider about how these interventions and other interventions can help impact the birthing environment and your ability to move freely during labor and birth. A general rule of thumb is the more you can move, especially in the first stage of labor, the better. The less chance of having your labor slow down, the better chance of having your labor progress quickly. And again, as a pelvic floor PT, I care about this because the longer our labor, typically the more likely we are to have issues with our pelvic floor in the postpartum period. It doesn't mean just because you had a long labor, it means you're going to have floor dysfunction, but your chances just increase significantly. So many hospitals and birthing centers offer showers and bathtubs in labor. And then, they also will offer birth props like stools, balls, those kinds of things. If you go on a tour of the facility, you can see what they have, but then you can also ask questions of, I see you don't have a ball. Can I bring my own ball? Or even though you have balls, I'd prefer to use my own ball. Can I bring it? All kinds of questions like that. Um, and then another important thing that I care about is a pelvic floor PT is what positions can you deliver in? So talk with your provider, regardless of whether or not you choose to have an epidural. If you choose to have an epidural, your positions are typically limited to the bed. Just for safety reasons, an epidural not only numbs the pain, but it makes you basically unable to move your legs. And so it wouldn't be safe to have you in a squatting position or things like that. But that does not mean that you have to deliver on your back in the typical position that you see in the movies. The woman's on her back, somebody's holding both of her legs up in the air and she's pushing. It doesn't have to be that position, but have that discussion with your birth provider. You want to talk about that before delivery, not, in the middle of it when you're getting ready to push. So a few of the positions can be laying on your side. If you didn't have an epidural, kneeling on your hands and knees, squatting, standing. Um, Look at the different benefits of delivering in positions other than lying on your back. Again, I care about the pelvic floor the most because that's what I do and what I see every day. Laying on your back is probably one of the least beneficial positions for your pelvic floor. So, like we said, birth is very dynamic and sometimes it does not go according to our plan. Babies and births have their own plan and they will always win that battle. So it's important to remain flexible and be prepared to do things differently from what you originally wanted. For example, your doctor in certain facilities may not be able to, or they may not be available on the day that you deliver. So you might not have your choice of providers, as there could be complications with you or the baby throughout the labor and delivery, and that can kind of alter how things are going. So, as much as we plan, one can trust that they've been prepared to meet the challenges that arise long before we became pregnant. So during your prenatal visits, talk to your provider about what could happen during labor and include some alternative preferences in your birth plan, such as contingency planning if you need a cesarean birth. That way we know, is my backup plan realistic, or did I just come up with a really good, you know, plan A, but plans B through C aren't really feasible either with what's going on, with where I'm delivering, with who I'm delivering with. We want to make sure all of our plans are solid. That doesn't mean you need to have 100 plans, but just make sure. So if complications arise or the need for a change arises, this way you and your provider and your birthing team can involve you in any decisions to ensure your health and your baby is delivered safely, but also it's in a way that you are happy with. So it's a good idea to think about who you might reach out to help create your birth preference list. Your provider might be your first resource, but there's lots of other um, places out there that can help you in the process, or just kind of help you get kickstarted and start to give you some ideas. So here are some great resources. Sankofa Birth Workers Collective of the Inland Empire includes midwives, certified doulas, lactation consultants, community advocates, and other supporters. And they also offer free doula services for those who meet eligibility requirements. The March of Dimes is a national organization that provides education and advocacy for all moms and babies. And they actually have a birth plan template and more information that can be found on their website there at marchofdimes.org. The Riverside Community Health Foundation is a maternal wellness program that offers a variety of support for birthing people and their families. Supports can include things like doula access program, childbirth preparation classes, and mother and baby program. And then we also have Loma Linda Loma Linda University Children's Health. Aside from being a hospital where you can birth your baby, Loma Linda also offers prenatal care and classes and workshops. And these can include the Birth and Beyond Education Center, childbirth and breastfeeding classes, support groups, infant and child CPR, and car seat safety. So now I just want you to take a moment and think about if there's anything that you would want to discuss with your birth provider about your birth preferences. And, you don't necessarily need to write something down. It can be great to write things down, but just kind of take a moment and start to think about some things based on what we talked about that maybe you would want to be your preferences. All right. So I just want to say thank you for spending time with me tonight on our webinar Wednesday, or if you're watching the recording, for taking the time out of your day to do so. I just want to say thank you. This presentation was developed in partnership with the Maternal Health Network of San Bernardino County. It's a collaborative committed to supporting families before, during, and after pregnancy. If you want to learn more about them, please visit their website. It's www.maternalhealthnetworkssb.com. Does anybody have any questions for me tonight? If you are watching the video replay, feel free to comment below in the comment section, and I will do my best to answer any questions that are posted on there. But I don't hear or see any questions, so I hope everybody has a good rest of your night, and I hope your labor and delivery go very smoothly and just how you want.